Well, like I said, grew up in Louisiana. In college, I studied biology, and my intention was to go to medical school originally. Started working at Lafayette General Medical Center when I started college, and ended up working there through all my college days, and then ended up staying on a couple extra years. And through the course of trying to get that experience to prepare for medical school and so forth, I decided that I kind of became aware of public health as a field, and I decided that's where my true passion lied, was to practice public health instead of going into medicine. So I started researching schools. I chose Tulane School of Public Health and Tropical Medicine in New Orleans, Louisiana. So I pursued my master's degree in public health at Tulane. My emphasis was health education and communication, so I was in the community health sciences department. Again, health education, communication, the bulk of which is about developing theory-based, evidence-based health promotion, health education campaigns and programs. Also, when I joined Tulane, I also applied to the U.S. Peace Corps. So that was part of my graduate experience. There's a program called the Master's Internationals program, where you apply for the Peace Corps, at the same time you apply for a graduate school that participates in the program, and then instead of writing a thesis or doing some sort of practicum within the scope of the graduate school, if you're accepted into the Peace Corps, you ship off overseas, and then your Peace Corps service sort of serves as your practicum. They call it the capstone at Tulane. So that was graduate school. I served in the Republic of Mali in West Africa, and since I had already been through graduate school, my service was a little different in the sense that I was assigned to work for Save the Children USA. So I was considered, my job was considered a health education specialist, and I worked with their school health and nutrition program, and did just a little bit of HIV/AIDS work as well while I was there. A lot of other, if you want to call them regular volunteers, typical volunteers tend to do more community grassroots development in their villages. I actually had a kind of an 8 to 5 job to go to every day, Monday through Friday. So served there, and I returned to the U.S. After much introspection, and I was trying to decide, what aspect of public health I wanted to go into, as I was looking at county health departments and things. I became aware of college health as a career, so actively pursued college health, and I've been here ever since. I think that the Peace Corps' motto, "It's the toughest job you'll ever love," is probably the most accurate motto I've ever heard of from any organization. Every day was absolutely incredible, and it was also very challenging in a number of ways. So having to learn new languages, get accustomed to new culture, customs, just try to put yourself within a whole new different cultural paradigm was challenging. And then also I was sort of I was brand new out of grad school, so still trying to find my way as a professional and working as a healthcare professional in a sense for an organization in a developing country was also very challenging. But probably one of the most unique, probably definitely the most unique and one of the most wonderful experiences I've ever had. Why do I like vanilla ice cream instead of chocolate? I don't know. I always, ever since I was a little kid, I had the little plastic doctor's kits, and I used to always just want to work in healthcare for as long as I could remember. So when I got to college, I started studying biology, and I was thinking pre-medicine and that whole thing until I fell in love with public health. So it's just sort of been for me just where I always wanted to go personally. I guess professionally, if I have an expertise professionally, it's probably substance abuse prevention. I've worked with nationally award-winning campus community coalitions in terms of substance abuse prevention, so keeping young, not necessarily college students, but just young people in the community from trying to experiment with and use and abuse alcohol and other substances. So I've developed professional expertise in that sense. And I've continued that along with my university setting work, and I brought that over here. I guess working within the domain of substance abuse prevention, which I feel very strongly about, not only so much in the college setting, but also in general, and been able to work towards doing something about that and becoming a professional or an expert in the field is really rewarding. And I would consider that one of the capstones of my career thus far. I said I went to college health. I was thinking I was going to work for a county health department or something a little bit more traditional in terms of public health. And I ended up finding a job as an alcohol, tobacco, and other drug prevention specialist, which is a mouthful, but that was at the College of Worcester in Worcester, Ohio.
Okay.
So I ended up taking that position, and I think the long and short of it is I found a posting for the position which I currently held, applied, and then I've been here since August of '07.
Okay.
One of the things I'd really like to do, and this is sort of generally speaking, is really do work with the student body to show, outreach of the Wellness Center. I don't want the Wellness Center to be perceived, or either by perception or by function, to be just taking care of injuries and illness. I really want us to have a very comprehensive, integrated wellness approach. So a lot of outreach on campus. I want students to recognize and experience the benefits of preventive medicine, if you will, taking care of oneself and learning healthy behaviors and healthy ways of living so as to prevent illness or injury or disease. So that way, hopefully, we won't, prevent folks from having to come here for healthcare services in the first place. And also working with our counseling center staff to promote mental health awareness and have folks come in and utilize our counseling services as well. So just generally health promotion and wellness for all students, and just actively challenge and engage the student body to participate in healthy lifestyles and healthy behaviors.
Okay.
Yeah, about Northwest specifically, I didn't really know much about the campus when I first saw the job posting. I was really impressed with not only the student body, but also just the staff. It's not a huge university, but at the same time, it's not a small university like the one I worked at before. My previous university had about 2,000 undergraduate students, no graduate students. So to me, this was sort of a bigger school. What I was really impressed with was how close-knit all the faculty and staff were, how well the faculty and staff worked together. So for me, I thought that was really, really neat to be able to have those really, really close interactions with everybody from the vice president of student affairs down to any other position on campus, higher or lower, up and down the hierarchy. So I thought that was pretty neat. And then after actually starting here, because it was the summer, I didn't get to meet too many students. I've just been very impressed with the student body as well. So just the general attitude on campus from everybody, just the general environment, I think is really, really pleasant.
Okay.
Oh, what don't I do? I've been playing, I'm an avid guitarist, so I've been playing guitar for probably about 17 or 18 years now. I lived in New Orleans for a while, so I picked up playing the blues down in New Orleans. I think I'm pretty good, but that's, I guess, open for interpretation. So that's one of my hobbies. That's just a big stress reliever for me. The other one I've taken up, I've always been a runner, but the past 2 years I've taken up marathon running. So I've run a handful of marathons. I've done an ultra marathon last summer as well. So that's, when the weather is not like this, that's what I try to get outside and do. Well, I do like the blues, but I've always been a rock and roll kind of guy, especially classic rock. Grew up with it. Very fortunate to have a very good vinyl collection at home, so grew up listening to classic rock.
Okay.
As far as I can see into the future, I'm one never to say never, but as far as I can tell, at this point, yes, I want to continue to work in higher education and healthcare. I'm very content, and I'm challenged in a good way with my position now. I'm learning lots of new things here at Northwest, especially as my role as the Assistant Director of Health Services. I'm learning tons about the operational aspects of a clinic and so forth. I've never been exposed to that before, at least professionally. So in the meantime, I'm happy here learning lots of stuff, but someday down the road I think I would like to actually be the director of a wellness center itself, and that's something I'm working towards. Haven't made any definite plans to go back to school, but I wouldn't mind pursuing a master's in business or something to that effect to kind of give me a little bit more experience in just the managerial aspects and financial aspects of running a facility or running a business. But that's way down the line. Right now I'm still learning, and I'm happy to be here doing what I'm doing and learning what I can.